Hi, I'm Jolene Beer, and this is Nursing 2 Nasogastric Tube Insertion. I'm going to scan the room for you. This is my patient, Brandon Richmond. Okay. So first things first, I'm going to come in, I'm going to wash my hands. I am going to explain the procedure to my patient, let her know what's going to happen, and if she has any questions, she can ask questions now. So I'll come in, I'll get her all set up with my supplies and everything. Put this over her that way we don't get anything on her gown. An emesis basin, a box of Kleenexes here in case she needs them, so she can reach them. Okay, and then I'm going to ask her questions about her nostrils. Does she have any polyps? Has she ever had any issues with any nose issues, any drainage, cloggage, anything like that? Alright, and then I'm going to check her nostrils myself to see which one works better. Okay, I'm going to go with this one. They both work fine, so I'm just going to go with that one. Okay, after that I'm going to take this, I'm going to measure it from ear to nose, about 3 to 4 inches. And I'm going to go there, I'm going to go down to her stomach, right under the xiphoid process, right there. Okay. And I'm going to put a piece of tape here. That way I know how far to put the whole tube in. Okay, I got my 3 to 4 inches. I'm going to coil it. That way it can go down the correct way the nasal cavity goes, kind of in a rounded motion. Okay, I'm going to put a little lube on it, the bottom of it, for easy insertion. She's going to be sitting at 60 to 90 degrees. She's going to look straight and her head is going to be back. Okay, so I'm going to do the first 3 to 4 inches, so I just need you to look straight and put your head back. And I'm going to insert it into her nose. And if she's gagging or anything like that, I'll stop. And we have a hand signal of stop. She'll just put her hands up if she wants me to stop. Okay, I got the first 3 to 4 inches, so I'm going to give her a drink of water and ask her if she's doing okay. Are you doing okay? Okay. And I'm going to finish the rest, and she's going to hold this cup of water and she's going to drink. She's going to swallow every time I go in. So I'm going to start to go, and every time I say swallow, I need you to take a drink and swallow, okay? We're going to go in, swallow, 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 one more big swallow, and swallow. Are you doing okay? Mm-hmm. Okay, so I'm going to take the other piece of tape. Let's cut in half. I'm going to tape it to her nose. And I'm going to take the one side, I'm going to wrap it around it to keep it straight in there so it doesn't fall out. Because we don't want to do this again. Okay? There we go. This. Okay, now I need to check and make sure that it's in the stomach. So I can check by using my stethoscope and inserting air and listen for a swoosh in the fundus. So I'm going to do 5 to 10 cc's of air, 5 to 20 cc's of air, excuse me. I'm going to put it in here. I'm going to listen to the left of the fundus, which is the xiphoid process, and then to the left. And I'm going to listen for a swoosh. Okay. I hear a swoosh, but at the same time I need to check stomach acid, so I want to make sure that it's in there safely, and I want to aspirate a few milliliters, that way I can get some stomach acid, because I'm going to check the pH. It needs to be below 4 to make sure that it's in the stomach. Okay, that here, down here. I'm going to come over here and use my strips. I'm going to put it on the strip, and it's at 3, so we're good. We're in the stomach. So I need to take this and wrap it around and completely, adhere it to the tube. That way it doesn't fall out. Okay, and then I want to give her some leeway, so I'm going to take another piece of tape, pull out right here. I'm going to tape it to the gown, just like that. I'm going to turn on the section to a low intermittent section and make sure everything's okay. Uh-oh, I forgot to do all this stuff. Oh, that's fine. And that's good there. Okay? And then we're going to make sure that the tube is off of the stomach wall. So we're going to put in about 5 to 10 cc's of air again. And you're going to go into the blue. It's the only time you put anything into the blue tube. Okay. Air. We're good. Okay. Put it here. Do you feel okay? Everything okay? Am I done? Okay. And I think we're done. Patient's okay. She's not gagging or coughing. If she was gagging or coughing, I would have her open her mouth. That way I can see into the back of her throat and see if there's a coil or anything like that. And if that was the case, it would need to be fixed because it's not, the tube that is measured is not fully into the stomach. And that's it.